Hi, my name is Brian Ballard. I'm here to talk about Medicare coverage for people with diabetes. I've also been a type 1 diabetic since 1974, and I've been a health insurance agent since 1995. Over the years, I've worked for Medicare health plans as a Medicare education specialist. With these plans, I have provided diabetes education for people over 65 and their families. So let me get started here. I have a PowerPoint I want to do. So I'm going to be talking about Medicare and diabetes. The first section will be Medicare 101. What's Part A, what's Part B, what's Part D? And then later on, I'm going to incorporate how diabetes, what Medicare covers for people with diabetes. Now, right now, there's 60 million people in the United States that have Medicare. 20 million, or 1/3 of those people, are people with diabetes. Medicare is for people 65 and older, and for people who are Medicare, Medi-Cal, and people who have Social Security disability. If you've been on Social Security disability for 24 months, you are eligible for Medicare. Now, I'm not going to talk about Medicaid, but from time to time, you'll hear Medi. All I'm going to talk about today is Medicare and not Medicaid. Medicaid is a state program, and those benefits vary from state to state. Today, it's just Medicare only. Now, how do you qualify for Medicare? You qualify for Medicare if you paid into the Social Security system for 40 quarters or 10 years, or you've been married to someone for 10 years who also qualifies for Medicare. And as I said before, if you've been on Social Security disability for 24 months, you are eligible for Medicare no matter what your age. You could be 20s or 30s. If you've been on Social Security disability for 24 months, you are eligible for Medicare. Now, there's three different parts of Medicare. Part A is the hospitalization. Part B is the medical insurance, or what we call outpatient. And Part D for drugs is the pharmacy benefits, prescription drug benefits. Now, how much does Medicare cover for your healthcare benefits? Medicare alone only covers 80% of the Medicare approved amount of the healthcare benefits. But before it covers 80%, you have a $1,500 deductible before Medicare kicks in. Same way with Part B, outpatient doctor visits. It only covers 80%, but you have a $233 deductible before Medicare starts paying. And then on Part D, it also only covers 80%, but you have a $480 deductible before it kicks in. Now, keep in mind, I'm only talking about Medicare benefits only. Later on, I'm going to talk about how supplements and Medicare HMOs play into this. So how much does Medicare cost you? Well, during your working career, you paid into Medicare through your payroll taxes. And that's how you paid for Part A. Once you go on Medicare, you're going to have $170 for this year, 2022, deducted from your Social Security paycheck. You pay this every month. Now, if you go on Medicare and you're not receiving Social Security yet, you've got to write a check to Medicare for $170. Now, the Part D drug benefit varies from plan to plan. You're going to have to shop around for the best deal with premium and coverage and benefits for Part D, and I'll talk about that a little bit later. Now, every year there's an open enrollment. You see tons of TV commercials around September, October. Open enrollment is October 15th through December 7th. And this is a time when you could review your benefits, shop other plans, see what's good for you. You could enroll for October 15th through December 7th, and it goes effective January 1st. This is time to review health and drug plan choices. Now, if you're turning 65 or you're getting ready to go on Medicare before your disability, you have 3 months before you turn 65, the month you turn 65, or 3 months after you turn 65 to enroll. You have a 7-month enrollment period. Now, when you go on Medicare, you go on Medicare the first day of the month. So say your birthday is July 15th. You will go effective July 1st on the month you turn 65. And this is when you join Part B and Part D drug benefit. You're automatically going to be enrolled in Part B, whether you do anything or not. You do have to physically or go online to enroll in Part B. Now, there's also a special enrollment period, and you have a 8-month period that you can enroll into a special enrollment period. This is when you might have lost health coverage through your employer, you're changing health plans, you move in and out of a service area, you lose benefits from your former employer, or the supplement benefits has changed. This is considered a special enrollment period. So you could enroll anytime when this happens, and you do not have to wait till October 15th to enroll because of this, your special enrollment. Now, when you go on Medicare, if you do not enroll in Part B when you become eligible for Medicare, you will receive a penalty. People don't enroll in Part B or do not want to enroll in Part B because it's expensive. It's $170 a month. And so they may choose to not enroll in Part B. Part D is the same. If you do not enroll in Part D drug benefit, you have a 1% penalty per month that you will pay into Medicare for not enrolling. So you don't enroll in Part B or D when you're supposed to, and you decide to enroll in later, you start paying the premium, but that is when you are going to also start paying the penalty. Now, here's what the penalty is. Say for 2022, this year, the premium is $170. 10% of that is $17. So when you go on to Part B after you've refused it, you're going to have to start paying the premium plus the penalty, and that would be $187 for instead of $170. But say next year in 2023, the standard Part B premium goes up to $200. You're going to have to pay 10% of that $200. So each year it increases, and you will have to continue paying those penalties despite the original premium. So it's so important that you enroll in Part D and Part D drug benefit and the Part B outpatient when you are eligible. Now, there's an exception where you do not have to enroll in Part B and you will not be penalized, or Part D. And this is when you have health insurance through your employer and you also have Medicare. Now, the key here is working full-time. If you are working full-time for your employer, and that employer provides you 100% health care coverage, you do not have to enroll in Part B. Now, your spouse is also eligible for this. So you and your spouse do not have to enroll in Part B because you're receiving full health care coverage with your employer. Now, say you stop working. When you stop working and you have retiree health benefits, that is when you enroll in Part B. It's very important that you do not mistake retiree health coverage from health benefits that you are receiving from your employer as an active employee. You must be working full-time in order not to be paying Part B. Okay? Now, who's primary and who's secondary when you are working? You have insurance through your employer, and then you have Medicare. When you're working, your employer is primary and Medicare is secondary. Once you stop working, your primary insurance is Medicare and your secondary is your retiree health insurance from your former employer. Now, there's other special enrollment periods I mentioned earlier. Say you lose your coverage from your employer, retiree benefits, you may move in and out of the service area. Your plan may reduce its benefits. And so there's many reasons that would trigger a special enrollment period where you could enroll during the year and not during open enrollment, October 15th. Now let's talk about Part A. What are the benefits? Part A is your inpatient hospital benefits. This includes all your medication, meals, nursing, drugs, supplies, inpatient treatment, surgeries. It also includes long-term care hospitals and skilled nursing facilities. Now, if you have Part A only, with Medicare and Medicare only, you have a very limited benefit. You have a lifetime 190-day limit in a hospital or for a mental health. So you want to look at these benefits and compare them to Medicare and a supplement, which we will get to later. Part A also includes skilled nursing facility. And when you go into a skilled nursing facility, it only covers 100 days per benefit period under Part A. Under Medicare only, you have to have a 3-day hospital stay before you can receive skilled nursing facility benefits. However, some Medicare HMOs and some Medicare supplements do not require that 3-day stay. Now, Medicare Part B covers outpatients, and this is where it covers surgical centers, outpatient labs, x-rays, it covers your doctor visits, it covers your specialist. In home health care, there's many benefits under Part B. Other benefits, preventative services like flu shots. There's tons of information. There's tons of benefits you can receive under Part B, and the key word is outpatient. Now, earlier we talked about Part D drug benefits, but did you know there's some drugs that are covered under Part B? Durable medical equipment is covered under Part B of Medicare. This could be wheelchairs, walkers, nebulizers, it could be insulin pumps, and the and immunosuppressant drugs is also covered under Part B, anti-rejection drugs for transplant. And home infusion services is covered under Part B. Now, if you have medication going through a durable medical equipment like an insulin pump or a nebulizer, albuterol that goes through a nebulizer is covered under Part B, even though it's a drug. Same way with insulin. If you have an insulin pump and your insulin is covered under Part B and not Part D as in drugs. Very important to know that. I'm going to cover the difference benefits between you obtaining your insulin through Part D or Part B. So durable medical equipment, nebulizers, insulin pumps is an example, and those drugs that go through those devices is covered under Part B. Okay. Now let's talk about prescription drug coverage under Part D. It's optional benefit available to everybody who has Medicare. It's run by private companies that contract with Medicare, like Blue Shield, Blue Cross, United Healthcare. And it's provided through Medicare prescription drug plans, also known as PDPs, standalone. But you can also obtain your Part D drug benefit through a Medicare HMO, or what we call a Medicare Advantage prescription drug plan. Now, there's other ways to obtain your Part D. There's other Medicare health plans, but once again, if you're working full-time and your employer is providing credible coverage for Part D drug benefits, you're getting those drug benefits through your employer. If you're working full-time, you do not have to purchase Part D. That'll save you money. Now, there are 4 sections of Part B, Part D as in drugs. One second. There's your deductible. There's your initial coverage. There's your coverage gap, or what we call the donut hole. And there's catastrophic coverage. Now, this year for 2022, you have just by having Part D alone, not obtaining drugs through a Medicare HMO, this is the bare bones credible coverage. You have a $480 deductible before the benefit even kicks in. Once the benefit kicks in, the credible coverage for this year is $4,430. But Medicare allows those Part D plans to charge up to 25% coinsurance or co-payments for those drugs. So after you pay 25%, the plan pays the 75%, which will equal to $3,323 benefit for that year. Now, say you have a drug that costs $100 and 25% of that $100 is $25. So the health plan will pay $75, you pay $25. But the way it's calculated, Medicare calculates as that full $100. So that $100 is going to come off that $4,430, which leaves you a benefit of $4,330. Very important to think about, because before this $35 copayment about insulin everybody's been talking about, if you have a bottle of insulin that costs $200 and you pay a $25 copayment, $200 is going to be deducted from that $4,430, not the $25 or $35 copayment. So you're going to go through your benefits quickly for high price drugs like a bottle of insulin or other expensive prescription drugs. Once you go through your healthcare coverage, your benefit of $4,430, you are in the donut hole, or what we call the coverage gap. You're going to have $7,050 out of pocket spent before catastrophic coverage kicks in. However, since 2005, when Medicare Part D started under the Medicare Modernization Act, each year the Medicare has required the health plans to start covering a little bit through the donut hole. So now we're in 2022, and many pharmacy manufacturers are providing discounts when you're in the donut hole. These discounts could be up to 75%. Some plans, Medicare HMOs, will cover generics in the donut hole. So it's really come a long way with the advancement of the benefits for the donut hole. So eventually, in the next couple of years, there may not be a donut hole under the Part D drug benefit. Now, right now, while there's a donut hole, once you spend $7,000 out of pocket, you go into catastrophic coverage. That means 95% of your drugs will be covered, either 5% or $2.25 or $5.60, whichever's higher. So you're going to get catastrophic coverage once you go through the donut hole. Now, just like commercial health plans, there's different drug tiers for Medicare Part D. You have your preferred generics as Tier 1, non-preferred generics Tier 2, Preferred name brand is tier 3, non-preferred name brand is tier 4, and then you have specialty drugs. And specialty drugs like cancer drugs, chemo drugs, stuff like that. Now, what are you going to do with your Medicare? Medicare only covers 80% of the Medicare approved amount. So you could purchase a Medicare supplement. And so you have your Medicare, you have your Medicare supplement, and you could go anywhere you want to with Medicare. You do not have a medical group or HMO. You do not need a referral to obtain coverage when you have a Medicare supplement. But if you have Medicare only, you also might have a retiree benefit through your former employer that will pick up the 20% that Medicare doesn't cover. Also, that former employer may have enhanced benefits through that plan. Now, there's another way you could have your 20% picked up. It's through a Medicare HMO or what we call a Medicare Advantage plan. So these Medicare Advantage plans have enhanced benefits, extra benefits. You may receive dental, vision, eyeglasses, maybe over-the-counter medications they're starting to cover last year and this year. And so you're going to have you may have lower co-payments, zero co-payments, zero premium. So when you join these Medicare HMOs, zero premium for you. You must continue to pay your Part B premium. But these Medicare HMOs are receiving payments from Medicare. So a Medicare health plan like Blue Shield may be receiving $1,000 per month per member to take care of you. In return, they're going to cover 100% hospitalization, 100% doctor visits, a very rich Part D drug plan. You want to look at that. And the catch is, the negative is that you must go to their network of providers. You must receive referrals from your primary care physician. The only time you do not need a referral with these Medicare HMOs is emergency room benefits or urgent care. No matter where you are in the country, you do not need a referral for emergent care. Now, traditional Medicare alone only covers medical benefits in the United States. However, these Medicare HMOs, some of them may cover emergency and urgent care benefits outside the United States. I've seen some plans that will cover up to $10,000 in emergency benefits outside the United States. So you want to shop around for the different HMOs that you may be eligible for. Okay. Now, with these Medicare HMOs, some of them have special needs plans where you can enroll anytime during the year if you qualify. If you have ESRD, on kidney dialysis, you could enroll into a special needs plan if that insurance plan offers a special needs plan for ESRD. There are some health plans that offer a special needs plan for people with diabetes. So you do not have to wait till October 15th to enroll in these plans. You could change from one Medicare HMO, let's say Blue Shield, and then you could go over to the United Healthcare that has a special needs plan for people with diabetes. You could only change once during the year to go into a special needs plan. This doesn't count your open enrollment October 15th. Other special needs plan may be for COPD, heart, and if you're Medicare Medi-Cal, that's considered a special needs plan. You could change anytime during the year. The rules that are Medi-Medi is not the same as the others where you can change just once. If you're a Medi-Medi, you could change anytime you want to every month. So they have that opportunity. Now, with these special needs plan, you have enhanced benefits. So diabetics may have zero copayment on insulin. Diabetics may have additional benefits. So you want to look at these special needs plan to see what those benefits are from plan to plan. Now let's go into the diabetes benefits under Medicare. CGMs are covered under Part B of Medicare. Most of the CGMs out there are covered under Medicare. The Dexcom is covered. Medtronic's insulin pump and CGM is now covered. Effective February 28th of 2022, Medicare is now covering the Medtronic CGM. Prior to February 28th, just a few days ago, Medicare did not cover the Medtronic CGM. Now it is covered. The Abbott's Freestyle Libre is covered under Medicare Part B, and the implantable CGM Eversense is covered under Medicare Part B. Now, there's only one other CGM left that I know about, and that's the Guardian with Medtronic. It is not covered under Medicare. The reason why it's not covered under Medicare is because it transmits its signal to a smartphone. And right now, Medicare has issues with smartphones, but I'm going to contradict myself in just a few moments. And in general, Medicare hasn't had an issue with smartphones. The Guardian does not have a handheld receiver like the other CGMs, like Dexcom has a handheld receiver, and the other CGMs, like the Eversense, has a handheld receiver. The Guardian does not, so it has to transmit to a personal device, where the other devices are considered DME devices, durable medical equipment. So we may be seeing the Guardian in the future covered. It depends on what Medicare and the FDA is doing. So right now it is not covered. Now, in general, there's some really strict rules to have Medicare cover a CGM. First of all, you have to have diabetes. That's one rule. And the second rule is that you have to be using 3 or more multi-daily injections or a pump to qualify for a CGM. You cannot be on Lantus alone, long-term insulin, and qualify for a CGM under Medicare. You must be multi-daily injections or on an insulin pump to acquire CGM. Also, the treatment requires the beneficiary to frequently adjust your insulin through therapeutic changes with your CGM. So you must be constantly adjusting your insulin to have a CGM covered. And you must have seen your doctor in the last 6 months in order to acquire a CGM. And some health plans will require a log of your blood sugars for the previous 3 months. And one last thing, to remain eligible for the CGM, you must have a regular visit with your doctor. You must be seeing your doctor every 3 to 6 months for your doctor to evaluate the CGM therapy. Okay. Now, before July of last year, Medicare required you to have 4 finger sticks per day to qualify for the CGM. That rule has gone away effective July of last year. So people might still be thinking about that, but that's gone. Now, insulin pumps. Which insulin pumps do Medicare cover? Insulin pumps is covered under Part B as durable medical equipment. And then there's one pump that it's covered under Part D as in drugs. The tandem insulin pump is covered under Part B, and the Medtronic insulin pump is covered under Part B. The Omnipod is covered under Part D for drugs because it's a disposable device and it is not durable medical equipment. And the part and it's transmitted to the phone or your the receiver. So the Omnipod is Part D, and the other two are Part B. Now, Medicare has expanded benefits under the CGM in the last couple of years. In 2018, Medicare has allowed limited data sharing with the CGMs to share with a smartphone. July of last year, as I mentioned, it eliminated being required to have 4 finger sticks on your glucometer. And then July of last year, Medicare has changed the terminology from an injection to administration. Afrezza, the inhaled insulin, was not covered because it was not injectable under Medicare. So Medicare changed that so we could administrate insulin or administrate Afrezza, inhaled insulin. Now, before July, Medicare would only cover Afrezza or CGM, but not both together. But now they are with the change in rules under Medicare. Okay, 1 second. Now, February 28th of this year, just a few days ago, Medicare has combined the 2 classes of CGM into 1 class. The 2 different classes was that CGMs were transmitted to a insulin pump that, such as the Tandem, or it transmitted to a standalone device. Now they've combined these 2 classes of CGMs into 1 class. By doing that, it has allowed the Medtronic CGM to be covered. When there was 2 separate classes, the Medtronic CGM was not covered. Now, just recently, earlier I mentioned that the smartphones were not covered. However, they're still not covered because the standalone Guardian does not transmit to a durable medical equipment device, a receiver. But this year, the FDA has provided clearance to the Omnipod. January 28th, you can now bolus from your smartphone with Omnipod. This is FDA clearance. Later on, I see that Medicare is going to follow the FDA path. But right now, Medicare doesn't cover this, but I could see in due time that they will. And the big news is the FDA did provide clearance for the Omnipod on January 28th, and they cleared Tandem t:slim X2 insulin pump to bolus from your smartphone February 16th. They received that clearance. And I could see later on during the year that it's going to be approved under Medicare, but not right now. I talked to the folks at Omnipod, and they did say it's going to be under Medicare. And Tandem, I don't know yet. I'll find out shortly. Okay. Now, with people with type 2 diabetes, the CGM is not covered unless you are taking multi-daily injections and not just basal insulin. So the same applies to anybody. You must, anybody who's taken insulin, multi-daily injections, 2 or more, plus your basal insulin, you can get your CGM. My opinion, I think anybody who is on basal or whatever should have a CGM. Today, CGM is the standard of care, I believe, for people with diabetes. So hopefully Medicare is going to become more understanding with those benefits. Now, other diabetic supplies and equipment under Part B, the sensors, the syringes, test strips, CGM supplies, pump supplies are covered under Part B of Medicare. Now I want to talk about this $35 copayment that the government and the media has been talking about. It's called the insulin savings model, where the government was trying to require health plans to charge a $35 a month premium on insulin. This is not mandate, it's just suggested. It's volunteer under these different Medicare health plans, Medicare HMOs, or Medicare supplements. This senior savings model is not requiring health insulin manufacturers to drop the price of insulin. It has nothing to do with that. What they're doing is asking the health plans to drop the co-payments of insulin. And many health plans are. Many health plans, Medicare HMOs, may provide unlimited prescription drug for insulin, but you need to look at the formularies on which insulins are covered. Okay. Now, keep in mind, I mentioned earlier that insulin is covered under Part B if your insulin goes through an insulin pump, or if it doesn't, it's covered under Part D. Now, there's pros and cons with this. This is for a 30-day supply. Say you have a 30-day supply and you have an insulin pump. Part B has a 20% coinsurance, and Medicare health plans are allowed to charge you that 20% coinsurance under Medicare. So you receive $200 per vial is what your insulin costs under Part B. And you are using 5 bottles of insulin. The total cost is $1,000. So a Medicare health plan can charge you 20% coinsurance for that insulin, or $1,000. So you are going to have to pay $200 a month coinsurance for that insulin under Part B. Now, what if you get your insulin under Part D? It doesn't go through an insulin pump. With the new plans of health plans charging $35 a month copayment, you could get a 30-day supply of insulin for $35. So what if you have an insulin pump? Do I have to go through Part B? No, you're not required. All you have to do is have your doctor write a prescription for 5 vials of insulin, or the doctor could write a prescription for insulin to go through an insulin pump, then the pharmacist could run it through Part B. So I've heard many people on a pump who are on Medicare are worried about this because they want to take advantage of this new this new $35 copayment under Medicare that many health plans are voluntary charging for competitive reasons. So you keep in mind, you do not have to go through Part B. Your doctor could write a Part D prescription for that. You're not required to. Now, you also want to check the formulary of your Medicare HMOs. Some plans cover, most plans cover Lantus, but some plans cover Humalog or Novolog. I haven't seen too many plans that cover them both, Humalog and Novolog. So you want to look at that. And now they're covering the generic of the insulins, Lispro and Aspart. There's many new oral medications coming onto the market today. You want to check to see if they're covered under your health plan. Medicare requires a therapeutic drug in each class to be covered under any plan. But that's not going to cover all the prescriptions out there. And many new drugs are coming on the market for oral medication. You want to look at those formularies before enrolling into that health plan. And One of my important new drugs on the market is the Baqsimi and Gavoki. These are excellent new glucagons. I've used Baqsimi before. It's a wonderful drug. It saved me a few times. So these are, you want to check those formularies to see if this glucagon is covered under your Medicare health plan. So for more information about Medicare, you could go to medicare.gov. You can start an account, your own account with medicare.gov. And you could pay your Part B premium through Medicare if you're not having it, medicare.gov, if you're not having it deducted from your Social Security check. Under Medicare, you could shop under Medicare at this website. You could shop for different health plans. You could input all of your drugs, your doctors, and it will come up with different health plans that meet your specific needs with your drug coverage, with your doctor's medical group. So it's really a one-stop shopping there for Medicare.gov. Or you could call 1-800-MEDICARE to talk to someone live about your Medicare benefits. But Medicare.gov over the years, it has become more easier to navigate. Before, when it first came out, it was really difficult, but now it's pretty simple. You do have to sign up for an account with your Medicare number, but after that, it's going to be pretty simple for you. Anyway, I hope this helped you with your Medicare benefits and how it applies to your diabetes. My name is Brian Ballard. Thank you so much for watching.